no start button. Alright, let me. It says live now? Okay.
Well, hello, how are you?
Is there section?
There is.
You still haven't popped up yet. You see me? Okay. Okay. Who's this? Back. I still don't see it. Is your camera on? Is your camera on? No, I mean just through your computer. Yeah. Can you hear it through the computer as well? All right, can you hear me? Testing, testing. Testing, testing, testing.
Oh, good. Sorry, I'm kind of new. You left your room.
Okay. All right.
Sorry, I left your room.
All right. Perfect. So the only thing now is I need to make sure that the link that I gave Joy, she's able to access it through the. Let me see if I can give you the link that I gave to her.
Me too, I just sat on my bed. Yeah, I started packing up grab jewelry, and then I handed out jewelry. Is there like calling out numbers? For the bikes? Yeah, well, first like everything. I heard them for the bikes, they're like, oh, someone's here. When somebody was finally there to get one. I love like right. Oh.
There you go.
I'm sorry.
Yes. I'm gonna forward it to you right now. So it's at Soto.
It's cold. I felt so good because it's really like all the vendors and the setup. I was like, this is really good event. How are you? Yeah.
You sure?
Yeah.
Were you able to get
So,
that?
I think we really tried to stick to that schedule. So if we have, they did. And then put it down. So we're like, okay. I know. Yeah. Yeah. And like the scarf, the gloves, the stuff. I couldn't feel my legs when I got the collar. I was eating when I did it. Yeah. Yeah. I know, because of the actors were like, there was it was just like, okay, okay. Right.
Hello.
Hi, how are you?
I am well.
Yeah.
Right.
Right.
Here's Well, I haven't seen her log in yet.
Right.
So
Change the program.
if it doesn't work, what I'll do is I'll just switch
I know.
So John is all gone.
Very
Yeah,
nice.
I'm gonna stay.
You must, there must be a.
And I'm fine now, but it's just like, I was like, oh, yeah, it's
That's what I said 2 days ago, we were bundled up in jackets, freezing,
Yeah.
and now it's 90. I get into my car, I'm like,
yeah.
I know.
it's like 90 degrees. It's like, what, 105 in cars?
Yeah.
Actually,
It's
would
so
you
windy.
mind?
Like, I have socks on.
Got shorter, 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 and then it just got like
Like,
really short. She did that way for a while, then longer, longer, longer. So it's about that long.
yeah.
She likes, I think it was a little longer, she could never, so.
Yeah, I could get used to this. I kind of wear at least my shoulder. For some reason,
Melissa mentioned that she was doing the training services will go over here.
I saw her.
Or actually, could we have Joy present first and then the director?
Yeah.
Oh, that's good,
Yeah.
that's good.
Oh,
You're stuck
yeah.
the whole time.
I was stuck here the whole time also.
Yeah. I
I know, I see her now,
To direct
because before it was just like,
then we'll
scratch and go.
recap.
And now,
I'll
you know,
give
she
you
has
some
trains without six brushes.
So
So
straight
zero
down.
pulse there every once in a while.
Now, I just want to make sure that Joy is able to get onto the slope.
I just found out that.
Positioning.
I'm still being used to being this
Where's that
short.
camera? Nice.
Oh, I see. Afraid it was gonna be-
Are we in the wrong sound, or are we, because when you go to the camera, are you trying to get the screen? Or just you?
Just us really, but it's fine. It's fine if it gets part of the screen.
Yes, sir.
Let me see.
He was afraid of being jacked.
You know, there is a knack to, for sure. There is a knack to cutting women's hair short and not like your guys cut. And not,
Maintain a femininity.
yeah, it really is. I mean, she's had a couple of people she went to this one guy. He was like an artist. He was great. Unfortunately. But, yeah, she was like, I don't know,
Our show twice years with it. So I think she's trying to get in right now.
yeah, it's that kind of thing, yeah.
But
So,
I don't have access to, like, I thought you would
yeah,
show up on that
just
tool.
knows what to
She's
do,
not.
but, you know, a lot of times you get shortcuts.
I have her
I have a
office.
real shortcut.
Her call though.
Flat top. That, and sent to Benny, because we were down there for a little while.
I just emailed her asking her to call me as well.
It's like shear and shear.
That's right. Yeah, that's right. You gave up and you're out the door.
Oh, yeah, and it takes like 2 minutes. They have little vacuums. Oh,
Hey, Joe, how's it
actually,
going?
it's a clipper. So I haven't used them, and,
No,
you know, it was really funny.
Not yet.
The reaction of people.
Oh, no. So we're gonna go, people
Guys come up,
introduction.
anything I can do, sir? It's like,
And then turn it over to
Sir,
you.
you just let me know. No, I'm good, thank you. I wrote that.
Do you?
You know, military.
Okay. Alright, try hitting the link and accessing
No, it's a big regret because every time somebody asks, it runs it over.
Yeah, right, it gives it just a little more.
Yeah.
Google Plus Hangout.
Thank you for this.
You're welcome. Quarterly report.
As far as the basis.
Alright, so I hear the feedback, I hear it in the background.
Yeah.
I talked to 5 now.
For some reason, it's not showing me how to
And then we'll have our.
How to access you to put you on.
Stuff, because that is feedback on our services.
Right.
So,
Seriously, I think it's easier. Can't click on
Yeah,
the.
I don't know, you may.
What happened to the page
So as long as
besides
you're
this,
able
like
to
the
mention it,
actual page that like would show like comments and.
Let's just provide them business data,
That's,
and now you can use the information to expand the
yeah, we definitely will, you know. We're doing this anyway, but I just realized, you know, in order for you to be able
So there's,
to identify the stuff, get it, have it earlier.
can you invite her?
Yeah, that makes sense. So that's not.
Does she have a phone
not
number
big
we can
thing.
call her?
Okay.
That makes
Alright, let's
it
do this. I'll pull up the PowerPoint. Could you resend it? The link, the attachment was in the last email. I'll pull up the PowerPoint and then what we'll do is we'll call you. Get together. Would this number be okay? Alright. Yeah, we'll call you and then just navigate me through
Yeah,
the
definitely.
through the slides.
Sure you know, are.
Yeah. To both email addresses. Just be safe.
So we're going everywhere and for the association.
Nothing, building a generation. Yeah, that would be great. Love to sit down. Okay.
Or violence.
I think
L.
like
Duncan,
some sprinklers.
Oh.
Then they nicknamed it.
Workforce
So it's L. Duncan,
Okay.
LDUNCAN .ufl@gmail.com.
Oh,
L. Duncan, LDUNCAN .ufl@gmail.com.
She goes to dates and I guess majority will be.
UFL.
are you gonna be at the wellness conference?
Yes. Student.
West regional.
Yes.
So, can I go?
You were in the military, you'll go, look out, so fast.
Oh, thank you.
He says.
Yeah. No.
So,
Thank you.
Well, that's good. It's a good event. You know, there's a lot of good workshops. I've enjoyed it. Some of the activities I've noticed are kind of the same activities every year.
UFL, like University of Florida, have, I think Frank L.
Yeah, I don't want to do another cross the line thing. Cross the line if you ever.
Alright, perfect, thank you.
Cross the line.
Touching a few.
Sorry.
So this is her cell phone.
Yeah, it can be very
Sorry guys for the hold up.
experience.
Technical
Usually you need a
difficulties.
little bit of deep dive. I mean, and there's some great stuff. There's some great stuff. This is, you do it. Okay.
I'm not gonna cross a line anymore.
But no, it's learned a lot of interesting things too. I know, must be interesting to see what the focus is like.
Yes, thank you.
There's has been kind of emphasis on.
All right. For those of you who are logged in online right now, sorry about that. We've been having just a few technical difficulties, but Joy Burkhard from 2020 Mom will be calling in, or will be calling her shortly. So bear with us just a couple minutes.
You just came. Oh, you're already here.
All right. Hi, Joy. How's it going? Thank you. Thank you so much for joining us. All right, so thank you everyone for coming out. Thank you for those of you who are joining us online. This is the Maternal Mental Health Work Group. My name is Lester Duncan. I work for San Bernardino County Children's Network. At this time, we'll go around, and if everyone could just briefly introduce yourselves.
Hi, I'm Dr. Jim Haugen. I work with the Department of Behavioral Health. A lot of involvement with the other first 5 process of SART and early identification intervention services.
Thank you.
Hi, my name is Alam Axelrod, and I work for Victor Community Support Services, and I work for CWE with CWE, the FRC, and TBS.
Hi, I'm Leanne Mass. I'm a program specialist with the Office of Prevention and Early Intervention.
Hi, I'm Mark Sorensen with the Ontario Montclair School District and our PEI Family Resource Center.
Thank you.
I'm Damaris Nastase with Public Health, and I'm a health educator with CPSP program, and we work very closely with providers that, work in turn with patients.
Thank you.
Good afternoon, I'm Amanda Ferguson, and I work with First 5 San Bernardino as a staff analyst.
And I'm Martha Jimenez, and I work at RIM Family Services and their FRC.
Thank you.
I'm Paul Maldonado. I work at Bel Star Community Services, and I'm a peer family advocate.
Hi, my name is Norette Supply. I'm with United Way 211 as 0 to 5 specialist.
I'm Janki Naik. I'm the staff analyst at Children's Network.
All right, so for today's meeting, I wanted to invite Joy Burkhard, who's the Executive Director of the 2020 Mom Project. She's really been a strong advocate and organizer in Los Angeles, and now, from what I understand, and she'll tell you a little bit more about the organization, 2020 Mom is now going nationwide, and they've provided some phenomenal resources that they were showcasing at their conference back in February, the Emerging Considerations in Maternal Mental Health Conference. And I just wanted to give you guys the opportunity to hear a little bit about some of the toolkits that are available and make them available for your organizations to use as well in addressing maternal mental health issues. So with that said, I will go ahead and turn it over to Joy Burkhard, and I'll pan through your slides. Just let me know when to click next. I believe most people have background. Does anyone want further? Okay. Yeah. Yes, I can. 1 second.
Did you know that mothers give birth to 4 million babies in the US every year? Let's face it, it is a joy, but also a challenge to enter motherhood. There are a lot of diapers to change, feedings, crying, sleepless nights, learning to care for a new baby, dealing with hormonal changes, and more. And new moms are expected to rest and recover with all of this. It can leave any new mom feeling overjoyed, but exhausted, overwhelmed, irritable, and anxious. During this transition, 80% of moms will experience the baby blues, which can include tearfulness and sadness, inability to sleep, changes in appetite, and self-doubt about being a good mother. The blues generally last a couple of weeks. But up to 20% will go on to experience something more serious, like postpartum anxiety or depression. These conditions are the most common complications of pregnancy. The problem is that most of these moms will never get the help they need. Here is why. First, most expecting and new parents are never told about maternal mental health disorders. Second, there is a shortage of mental health doctors and therapists, and not all receive training in maternal mental health, and those who are qualified to treat are not easy to find. Third, most OBGYNs and pediatricians do not screen moms for maternal depression or anxiety because of a number of obstacles, like lack of time and not knowing where to send moms for help. All of this makes it a broken system, and as a result, hundreds of thousands of moms and families suffer in the US every year. But we can solve this. First, let's recognize doctors alone cannot solve this problem. Since most moms deliver in hospitals, and millions more will have health insurance because of the Affordable Care Act. The 2020 Mom Project sets forth an alternative path to change by focusing on what hospitals and health insurers can do to help. For example, what if hospitals informed women and their families during childbirth classes about symptoms of maternal mental health disorders, whether they are at greater risk, and common triggers such as sleep deprivation? What if health insurers identified maternal mental health specialists in their directories and helped moms find treatments? What if OBGYNs hung posters in their office listing the symptoms with an 800 number to call for help? These are just a few of the changes the 2020 Mom Project recommends. We believe that together, these simple steps can lead to a big change by the year 2020. Learn more and join the movement at 2020momproject.com.
we're really excited to have 8 health plans from across the country
Oh,
joining
one
us today
second,
for
Jen.
this discussion on the important work of the California.
The next video was showing. There we go. All right, you're good to go. I'm totally doing it. What's the hashtag though? What's the hashtag though? Moms matter.
Oh, moms.
All right. Only if you promise to use our hashtag though as well. Here in San Bernardino County, we've been doing hashtag You're Not Alone.
Oh.
I love it. Thank you. Certainly, and I would love to, and I mean, we are so appreciative of the amount of expertise, really a lot of the best practices that you guys have developed in Los Angeles, that we get to benefit from here in San Bernardino County. So we're really grateful for your support, for the resources that you're making available to us as well, so thank you. Did anyone else? Certainly. Did anyone else have any questions? Okay. Certainly. So joy@2020mom.org. All right, well, thank you so much, Joy. You're welcome to stay with us for the rest of the meeting. We only have a few more agenda items left, and then we should be wrapping up by about 4:30. All right, excellent, thank you. All right, so the next item that we'll talk a little bit about is the directory of services that we've been in the process of developing, and Melissa will speak a little bit to that.
We met with IT 2 additional times, and they are working on building it now. It's going to kind of resemble what we use in our department for our internal directory of services. And the link is going to be available on both the inter and intranet, and then we'll blast it through the group. We should have something to present to the group in July. So kind of like a model or a mock-up. Now there is some information I'm going to be emailing to the group. IT has some very specific questions about the services that you offer and what's available. And basically because when we go in and we fill out the form to populate your information onto the website, we need to know what exactly we're populating. We need to know exactly what services, exactly who your populations are. Now we have the information and the data that we've already collected, but above and beyond that, or if your services have changed. So we have some housekeeping things to do before we post it, but we're well on our way.
Awesome. Thank you so much for that. Next, we'll give some updates from Children's Network. So as you all know, we've been rolling out the campaign with an emphasis on "You Are Not Alone." Really trying to get the message out there that this is something that many new mothers experience. We know that statistics show 1 in 8. Some statistics show 1 in 7. Mothers experience postpartum depression after giving birth. So we've done so in the months of February and March through movie ads and through billboard campaigns and through posters, putting up posters in just about all county agencies that address children. So we're continuing to get that material out. We have several brochures available in both English and Spanish. Throughout the month of May, we're going to be doing another big push. We did a billboard purchase for the months of April, May, and June. And in May, we're going to particularly focus on maternal mental health. So we have 2 billboards. Rather than purchasing a wide array of smaller billboards in local communities, we decided that it would be more effective to get 2 billboards in very high trafficked areas. So we have one on the 15. You'd see it coming southbound on the 15 up in
Hesperia.
Hesperia.
Oh, wow.
And then the other one is here by the intersection of the 10 and the 215 freeway. Yes.
Have you thought of targeting OB offices that are in, low-income areas and deliver some of these posters there?
Certainly. So
if you need, or I can provide you with some addresses. I do work with the CPSP's comprehensive perinatal services, and that's what we do. We go to OB that they serve low-income people, and one of the components of our program is psychosocial. So I have not seen any posters in their offices.
Yeah, we haven't, we've been trying to target our doctors' offices. Instead of having the big posters that you guys have seen, we're gonna do half the size so we can reach more, because obviously there are so many. That's just in process right now, but we would love to have any interested doctors' offices, because I think that would be a very, very beneficial place to have it.
Even small pamphlets that will be in English and Spanish, of course.
Of course, and we have our brochures there, so you're more than welcome to those as well.
And feel free to take as many as you'd like. If you need more, we have more back at the office as well that we can provide to you guys. But we really want to push this material out throughout the month of May. And then also we are in the process of working on a PSA as well, addressing, again, postpartum depression, highlighting the statistics. So far in the PSA, we've recorded with Dr. Ketiyune Kaney, who's our subject matter expert, and then also Jackie Hezekiah, parents, Kathy, and we're looking for, in particular right now, we're looking to have a survivor face as a part of our PSA. We're looking hopefully to do kind of like a series of PSAs. This is just kind of an initial one, getting the word out there. Then we want to kind of drill into some of the more nuanced issues within maternal mental health, and also how it affects different populations. So I believe our next PSA will most likely specifically speak to the Hispanic populations. It will be a Spanish PSA, and we'll be working with Amelia Ortega Hara, who is a therapist locally. I believe she works with SAC Clinic, and one of her patients, or one of her former patients. So if you guys have any suggestions, if any of you would like to be in one of the PSAs, definitely let us know, and we'll be able to coordinate that.
And especially the client base, I think that would really bring that human touch to our campaign and really to show that, you know, anybody can suffer from it. It doesn't have to necessarily be a woman, it can be a husband, a child, aunt, uncle, extended family, whoever you think would be most beneficial, or, you know, just has a really good story that would really touch the county, so.
Like in pre-treatment, is that what, like, does it not like in pre-treatment in the early?
We're not sure about
days?
that.
Like how would you like it?
Preferably after, because I feel like if it's during, it just, you know, there could be triggers, it just might be difficult, especially knowing that these videos, once they're recorded, we're gonna have them playing in FRCs and SART centers.
Okay, so survivors.
Yeah, so we would prefer somebody who's been through it and is comfortable with their story being publicly shared. Not necessarily while they're in treatment, that might not be the best approach.
Any other questions? So those are our updates. I don't know, Dr. Haugen, did you want?
I don't have anything to add. Mike Trutel asked me to make sure I was here in case you said something, but he didn't mean anything to bring up.
I appreciate that.
Sure, no worries.
Also, the past couple of weeks, we had a couple of trainings. One that we hosted here in San Bernardino, over at the Department of Behavioral Health Auditorium in Rialto. Dr. Caney put that on, and it was great. Her and a number of colleagues were there to present. How many of you were able to attend that training? All right. Do you guys have any feedback? Anything? I know Dr. Caney had asked for feedback as well, but was there anything that you guys would have thought would have added more value to that training, or anything that you wanted her to dive deeper on for future trainings?
I think they did an excellent job in all aspects, and I feel that when I left, I really needed to just process that, take a couple of days and really process, because I really I'm hungry for all of this information. So I can't wait. In fact, that motivated me to start earlier date on future groups, because I was not going to start next month, and I have it on the calendar for the FRC in the Victor Valley area just after the training.
Wait,
because I was
a support group?
A support group
Okay.
for I called it health and wellness for mommies, like that. So that really motivated me a lot. So we have a lot of information. It's a matter of putting it to practice and implementing it and taking these posters in the community. So we have a lot. It was very good, and also I believe there was the psychiatrist that was extremely informative and was really direct and fast but good information. So I really appreciated it.
Nice. Yeah. After the presentation, Dr. Caney had mentioned that as well, that there was so much more depth that they could have gone into. I'm like, 8 hours. 8 hours seems like a long period of time, but it really wasn't enough. I mean, the way they nuanced it, they talked about. Medication use,
yes,
during pregnancy and after pregnancy, during the breastfeeding period as well.
That was very enlightening for me, as a clinician, because what we hear, right away when I went back to the clinic, I have a client who just found out she was pregnant, but she was depressed. So she tells me, oh, well, I don't know what to do. I can't take, antidepressant anymore. Really, I talked to my supervisor to request a consent form to talk to her OBGYN and collaborate right away due to the training that I have had. Before, I would not have known that, so it was very good.
Yeah, and many mothers just assume that, I'm pregnant
and
now,
they
so
suffer,
stop
and they
everything.
suffer.
they talked about the mental health issues that came as a result of that, and then also loss and grief in that process as well. Yes.
I like to say I'm a provider's advocate because I work with providers, and I think it will be very beneficial for these trainings to be extended to them. And you can also provide the MEs because you have all these presenters there. So I find out when I go to providers' offices that they are not aware of the help that's there. They're not aware. There's this total unawareness that there's help that they, and not knowing is probably the number one enemy of not referring. So if they will come to one of these trainings like we had, the one here, the one in the Riverside, I'm sure that will be very, very beneficial.
And so from what I understand, these trainings are developed keeping in mind the service providers that are contracted through the Department of Behavioral Health, but it's still open to the community. So actually for this training, it was open to anyone who wanted to come, whether it be a community service provider, a family resource center, medical provider. So I believe in that will be consistent for future trainings as well. We'll kind of leave it open to the community with preference given to DBH contracted providers.
We didn't know about it, kind of fell on it and found out about it like by accident.
Yeah.
So, yeah, in Old County.
So, are you on the mailing list?
I talked to you last week. I don't expect you to remember because there was a million people there. And I was supposed to get an email, but we remembered my supervisor. And I was like, oh, there's that meeting today, so I'm going to go crash the meeting. So please put me on your email.
Certainly. And if you guys haven't got a chance to sign in on the sign-in sheet, definitely do so. We'll make sure that you're added to the mailing list.
That is one of the best ways, and that's why I came here today, because you want to reach these providers. They are in contact with your patients. And we do have a component that deals with this very issue when they do their counseling. This very issue of how do you feel and what's going on and what's the history and that. So if we train the providers and in turn we train the people, the MAs that work with them, then you reach the people.
Do you think that it would be possible, I mean, this is something that we'd have to bring back to discuss, but maybe have a series of trainings during, I know that physicians have kind of grand rounds that they do, or during, I guess, a period of time when they're going back for continuing education. Do you think that would be a possibility?
I work with both OB and pediatricians, and the moms kind of fall in the crack because she's an OB patient just for 9 months, and when she goes with the child to the peds, then the child is the patient, not the mom. But I could help you put on like one big training and bring both.
For physicians. That'd be excellent. Remind me your name one more time.
Damaris, Damaris. And last name, N as in Nancy, A-S, T-A-S-E, Nastasi.
T-A-S-E?
Correct.
Any other feedback or suggestions?
Yeah, I really want to thank Melissa for all her hard work because she's really doing an excellent job regardless. She doesn't really, it seems to me that she takes everything seriously. It doesn't, like whether it's small like this, like from me, emailing her something, really silly or not. She has always responded, so I really appreciate your hard work.
Melissa's awesome. She's done a lot for, I've probably been blowing up
her name's everywhere. I say,
yeah.
So
yes, we do really appreciate you and the work that you do. Thank you. Any other? All right, well, with that said, and then 2-in-1 updates. Do you have any?
Updates, we've received some calls, I think we've received we've had 9 calls where we referred someone to either like a support group or a CSI line. We don't have the details just yet because the report hasn't been downloaded, so that's done like at the end of the month. But you can always talk to Gary about that. And then, I don't know, and from my understanding, since the training, we have the training, it's okay if we do get a mom that's, has her concerns, we can now refer them to a family resource center, closest to her. So we'll be updating our database too, and of course with, for right now.
So, thank you. All right, well, that said, really briefly, if there are any announcements, any quick announcements around the table? If not, the next meeting will be on July 28th, so we hope to see you there. Also, there is there's a film screening of Dark Side of the Full Moon that will be taking place on Thursday. For those of you who are on the mailing list, you received that information. For those of you who are not yet on the mailing list, we'll go ahead and send that out to you again. Dr. Caney will be one of the panelists at the film screening. All right. So that's it. Thank you guys so much for coming out. And we hope to be in touch with you over the next couple of months.
Okay, I would like to sign up. So it will be every 2 months then. Just trying to work out when that's because Mike wanted to discuss the training, so in July.